Roma communities in the Transylvanian rural areas face daily sanitary challenges. The uncontrolled water and food resources bring several health risks and deepen the discrepancy between Roma and non-Roma communities. Dr. Beldean and his team of researchers and their international partners aim to improve the health status of the population and thus the quality of life. Keep watching Research in the Spotlight to learn how real data about the quality of water and food resources can drive a better support tool for public decision-making. Professor Beldean, thank you for having us today.
Thank you also.
How is your day?
Here.
How's your day today?
Today was okay. It was a sunny day. So.
Currently, you are implementing a collaborative research project funded under the Norway Grants. Which was the main trigger when starting this project?
The main trigger when I started this project was the European Union reports from 2014, which stipulated that the life expectancy in the Roman community is 7 to 20 years less compared with the non-Roman community. This discrepancy appeared due to access to the health service, access to the labor market, equal opportunity, which together with the health service have a long-time effect. This inequality, such as high risk effect, less access to the professional health service, as well as with the poor lifestyle in the Roma community, are also stipulated in the European report. And even some step has been done in this direction. More action is needed because a specific healthcare policy can be effective when we know the specific problem which a personal community are face to face with these challenges. The interest for this project started when we found there is a lack of data regarding the analysis of chemicals and microbiological contaminants in food and water used for the Roman community, and from this reason good assessment of the health risk is difficult to be performed. So, together with the partners from the consortium, we decide to offer to the public authority and to this community a model, a working model, which is able to establish what is the disease warning for the consumption of the water and food from uncontrolled sources. So, the Roma Health Risk is an interdisciplinary research project which includes sociological investigation, chemical and microbiological analysis, medical investigation, public health risk related method, with the goal to increase the safety of the consumption of the water and food sourcing, and by this way to increase the health of this community.
Which are the main partial results that you would like to speak about?
Take into account that the Roma Health Risk is interdisciplinary research, so different type of research has been necessary in order to fulfill the engagement in the project. Thus, the project has 4 working packages. First working package is focused on the sociological investigation. The second part is dedicated to the microbiological and chemical analysis. The third part is dedicated to medical investigation and to estimate the health risk by computing model. And the last part is the public health related method aimed to realize a guideline of the hygienic practice in order to decrease the risk for the health in Roma community. For the sociological point of view, we built a questionnaire which consists in 29 items, which contain different type of items related to the sources of water which are used to the Roma community, the access to the water, also some information regarding to the health, regarding to the chronic disease, infectious disease, if they have or no have the connection with the family doctor, and other problems which is related to the health. And also we get the information regarding to the household how big is the household, how number of room they have, how many citizens are inside in this room, all together with the goal to select the most vulnerable community in Transylvania. In this regards, we select 25 Roma communities spread in all Transylvania, starting to the north to the east part of Transylvania, and we apply 886 questionnaires which cover a population in the range of 32,000 inhabitants. The main results show that most of the Roma community selected in this field has no access to the running water. They use the private wells or springs which are uncontrolled. And for this reason, it's difficult to estimate the health risks which can arise from this exposure. The second part was dedicated to microbiological and chemical research, and we perform this research both in the water and food samples. We select 57 water sources, and we collect more than 80 samples. In these samples, we analyze different inorganic compounds, such as different ions. We talk about nitrate, sulfate, chloride, different heavy metals, such as arsenic, chromium, cadmium, and also we perform the microbiological analysis, which consists in determine the Escherichia coli and some bacteria like total and fecal coliforms. From the results performed at this stage, we can conclude that 27 sources of the investigated water are not compliant because the quantity of nitrate exceeds the maximal allowable concentration in Romania. We have also 3 samples which we found arsenic in this. We know that in that region of Romania, especially in Satu Mare and Bihor country, there are permanent exposure to this type of the compounds. And also we have excess of sulfate, and also in some samples we found high concentration in iron. And other type of the chemicals is referring to the residue of pesticide. 3 different types of the pesticide we analyzed: chlorinated pesticide, triazine pesticide, and glyphosate. And the good news is that in the analyzed samples we couldn't find any pesticide. Regarding the microbiological analysis, from the 80 samples analyzed, only 3 samples are fulfill the Romanian requirements regarding the missing of any microorganism in these samples. All of other has concentration of Escherichia coli or other coliforms. With the help of the Norway partners, we extend this analysis, and we were focused to more specific analysis, perform not only to the microbiological but also for the parasitological analysis, both in water, and also we took the faces of the animals in order to establish if there are any connection with the parasites found in the water and parasites found in the faces of the animals. Regarding to the medical investigation, the main constraint was to the epidemiological restriction, and we are a little bit in delay. But anyway, more than half of the selected community was already investigating from the medical point of view. The medical investigation consists in the measure of the heart pressure, glycemia, and other general medical parameters. And also we perform the coproparasitological analysis in order to identify some parasites which can be done in these samples.
We are discussing a collaborative project involving a team of researchers with various backgrounds and an international partnership with a prestigious institute in Norway. What does it mean to you and the team you coordinate such a partnership with, and what are the benefits?
This partnership is a very good opportunity in order to develop real research, because as I told you, the project is an interdisciplinary aspect. So in this regards, we need different background for different institutions in order to fulfill the engagement in the project. Thus, for the social investigation, we have as partner the National Institute to Study of the Romanian Minority, which are a very good institute with huge experience in the sociological investigation, and also they know very well what is the problem of the Roma minority. Also, we need the microbiological and chemical investigation, and in this regard, Babelsberg University, Norwegian partner, Norwegian University of Life Sciences and National Institute of Public Health, they have a good expertise in analysis of water, chemical and biological parameters, and also to analyze the food samples. On the other side, we have medical investigation, and in this regards, we have University of Medicine and Pharmacy. We have a good experience in medical investigation, and also had good experience to realize a computer model in order to estimate the risk of the health. And also, not the least, we have a part which is regarding to the public health, and in this way, National Institute of Public Health has a good experience in order to prepare the guideline of the best practices of hygienic measure in order to increase the safety the Roma community in the consumption of water and food, and thus to decrease the risk, and in this way to improve the health of this community. Therefore, we consider that the benefit is that it connects and covers all the research fields necessary for the development of the type of the project, and that all the partners involved had the necessary expertise to successfully fulfill the objective assumed in this project.
In the end, what should people remember about your project?
About the project, the people should remember that the core of the project is the citizen and the local community, which are the main beneficiary of the project results. Also, the project is dedicated to the Roma community, one of the most disadvantaged community in Europe. The project is addresses to the local authority, which helps them by our model for the evaluation of the health risk associated with the consumption of water and food from uncontrolled sources. And also, the project has aimed to reduce the discrepancy between the Roma and non-Roma community due to its guide of the good hygienic sanitary practice.
Thank you for watching Research in the Spotlight, a podcast for scientists and passionate science people made under the Norway Grants research program by the Executive Agency for Higher Education, Research, Development and Innovation Funding as program operator. Until the next time, like and share this episode if you think science is a key to a better future.